The steps you take to prepare drugs before administering them are crucial in helping to prevent medication errors. That's why you'll want to establish and follow a routine each time you prepare a drug for delivery. Start by checking the patient's chart to see if he has any allergies. Also, review his lab values if needed. Now review the drug that you'll be preparing for the patient. If you aren't familiar with the drug, ask a pharmacist about it. Read the package insert, or look it up in a high-quality professional drug reference. Review the drug's indications, actions, adverse effects, interactions, and contraindications. Now closely compare the name of the ordered drug with the name printed on the drug container's label. Take your time and do this carefully. Drugs with similar sounding names and similar looking names may have very different indications and effects. Check the medication label 3 times. When you obtain the medication, when you open it, and just before you give it. If the drug comes in a unit dose packet, don't remove it from the packet until you're at the patient's bedside and ready to administer the drug. In this case, your last 2 checks of the drug label will be done at the patient's bedside. Also, check the expiration date printed on the drug container. After this date, the drug may lose some potency. Never administer an outdated drug. If you're not using a unit dose drug, you may need to perform some calculations to prepare the drug for delivery. Make sure you know how to correctly convert between measurement systems to determine how many tablets, capsules, or other dosage forms to administer. Whenever possible, double-check all your calculations with another nurse or with a pharmacist. Many facilities require these double checks when your dosage calculations are for children or for drugs with narrow safety margins, such as heparin and insulin.
We would use for this patient. Okay. 200. Yeah, that's right.
Sometimes you may need to break or crush a tablet to administer the correct dose. Before doing so, check your drug handbook to make sure it won't alter the drug's action. Drugs that shouldn't be broken or crushed include sustained release drugs, also known as extended release, timed release, or controlled release drugs, capsules that contain tiny beads of medication, enteric-coated tablets, and buccal or sublingual tablets. If you need to break a tablet, make sure it has a score mark. If it doesn't, the tablet may break into different sized pieces, giving you the wrong dose size. If necessary, ask a pharmacist to replace an inconvenient drug form with one that you can measure accurately. To correctly measure a liquid drug, use a dropper or medicine cup with markings you can easily see. Make sure the cup is at eye level so you can accurately measure the prescribed amount. Use your nail to mark the proper fill line. Make sure the label on the drug bottle faces up so the liquid won't stain the label if it runs down the side of the bottle. If you pour too much drug into the cup, discard the excess rather than pouring it back into the drug bottle. When preparing a drug for injection, make sure it's compatible with the other medications and diluents. Before giving the drug, inspect the contents of the bag or syringe. If you see particles, cloudiness, or a change in color, consult a pharmacist. You may need to discard the drug and start again. Label all syringes and IV solution containers with the date and time you prepared them, the patient's name, the drug name and concentration, and your name. When you finish preparing a drug for administration, double-check it against the MAR. Look for errors in preparation and also for possible problems or inconsistencies in the patient's total medication plan.